this is a pain to write. Okay. As to, whoops, if you want to, why am I reading this to you? Okay, so as a reminder, we're talking, whoops, we are talking skin,
We're live also
underwear,
on Facebook.
oh goody, etc.
I think you did.
Ah, okay.
I'll stay here.
Did I pin it? I did. Oops. Again, I don't know how many times I have to go through this to learn. No matter how much we set up in the pre-live to get comfortable, things kind of explode when we actually go live, and stuff doesn't work, and people come out of the woodworks to ask stuff, and all of a sudden I need to do... Hi, welcome. Okay, so today, well, I'll give it a few minutes just to get some people online and let people know that we're here. But yeah, it's a fun topic. I'm kind of psyched actually about the topic today because it's a topic that not many people like to talk about. So that's kind of perfect that we should talk about it. Okay, so we'll just wait like a few minutes to make sure people know that we're here. And by the way, if you guys have questions, it's best to get the questions in early so that we have time to answer them. And if you would like to ask them anonymously, you can do that. You can DM us on Instagram, or you can private message us on Facebook. And we have people who are monitoring to make sure.
So I'm gonna turn off the silent mode on my phone, and I'm going to work on this stuff I need to work on because I have a job.
Madison's summer job is helping us with stuff for the company, for VMV. Family company, folks. This is, it is what it is. Okay. Maybe I'll give it one more minute and then just welcome folks in. Hi, everybody. We are in Manila, where it is a relatively cloudy day, a little bit humid, not too bad. Not raining yet, so it's always in the Philippines. It's a tropical country, so a little bit monsoony, and at this season it gets really humid very quickly, so it's interesting. And then for those of you in the States, good afternoon if you're in the West Coast, good evening if you're in the East. And we've had folks join us from Singapore, Russia even at one point, de Costa Rica, de México. So, también si ustedes tienen preguntas en castellano, voy a probar a contestarlos. Es un poco difícil considerando lo que estamos hablando, pero voy a probar igual. No sé si voy a tener todo el vocabulario que necesito, pero bueno, voy a probar. Y sa Tagalog, also, kung gusto ninyo, yung mga tanong sa Tagalog pwede rin. Medyo mahirap, no, considering the topic, but pues, figure it out. And Bisaya, that'll be a challenge for my mom. Her first language is actually Cebuano. So she'll do quite well there, and I will absolutely flail, embarrassingly, but flail I shall. We will make the attempt. Okay, welcome everybody to our Skinsights on skin, underwear, sex, genitalia, smelling, body odor, and whatnot, sweating, all the stuff that, sanitary products, right? The stuff that might embarrass you, but really shouldn't, because these are our bodies and we love our bodies and our bodies are good and everything about them is really as they should be. So I felt, I've had friends ask me, oh my gosh, I'm having itching here or there or whatever, and I don't know what to do. And I'm like, talk to a dermatologist or talk to my mom. And they're embarrassed. And I'm like, no, actually, this is what they do. So first off, we all have different parenting styles, and we're not going to be sort of risque and flippant about anything here. It's going to be quite straightforward and scientific, but every parent has a different parenting philosophy, and And in our family, because it's such a medical family, we use proper names for genitalia. So even with my kids here, you'll hear us talk about, the vagina, the penis, and whatnot. If that makes you uncomfortable, then don't watch this with your kids. And we will be mentioning sexually transmitted diseases, and when you should see a doctor and whatnot. So, and we will be talking about condoms and lubes and things like this. Not getting into it because we're not sexologists. That's not what this is. But we will be talking about that. And if that is something that you would rather your kids not watch with you, then that is absolutely, no judgment. We all do our very best to parent the way we are most comfortable. But so that's what this is going to be. We will be talking about all that stuff. My kids will actually pop in. So I'm wondering if you have been curious about how to approach these discussions with your children. You might even get some ideas with the way we interact, or the way we interacted in the pre-live, which is on Instagram now and Facebook. So the first big thing I'll talk about is underwear, because it can cause several problems, and my mom will go into this quite a bit later, but underwear can have a lot of allergens in the material itself. There is something called clothing contact dermatitis. So if you're allergic to dyes in the material, latex, elastics, rubbers, and such, some materials that are not 100% cotton need something called mordants, which is a chemical that's related to metals, and metal is the top allergen, to help colors bind to the material better. There are several possible concerns, and obviously this would manifest in like itching in contact areas with the underwear, and my mom will talk about a condition of skin darkening over time in the groin. I know we have a question about that, actually. Darkening in the groin area. Some of that can be because of underwear. And there's a wonderful brand called Cottonique, Cottonnique. And they're quite phenomenal. And they do 100% organic, unbleached, unchlorinated cotton, latex, spandex-free, elastic-free. They're a great option if you do have clothing contact dermatitis. As well, what you wash your stuff in matters. So we normally suggest at VMV, we make a laundry soap called Fawn and Launder, which is allergen-free precisely for people with clothing contact dermatitis. And also, because it kind of drives me nuts that there are some laundry detergents that are marketed for baby clothes and baby things that are highly fragranced laundry detergents. To me, this is just asking for trouble with allergic skin and with very young skin. So Fawn and Launder is decidedly unfragranced. And because COVID, stocks have been funky. Our poor suppliers have also been struggling with keeping stuff in stock, which is affecting our supply chain. So I apologize to everybody, and we're working really hard. And contact us if you want to be put on a wait list. If we don't have Fawn and Launder in stock, a lot of people will use superwash, actually, and dilute it and use this for laundry, at least for your underwear, just your underwear. And if you're really, really sensitive to chlorine, my mom even recommends rinsing the underwear in distilled water. For washing genital areas, again, another real personal pet peeve is how many feminine hygiene products are marketed to women to somehow correct the way we smell. Like somehow this isn't normal, beautiful, natural, the way it should be. And you don't see the same products marketed for men for the most part. So that might be a whole other live stream for just me to rant. But medically, it's not actually recommended to use feminine washes and douches because a lot of these products do contain allergens, including fragrance, because again, they're trying to correct a smell that is somehow to be corrected. And they can be very irritating and can cause a lot of problems down there. Plus, we have a very delicate, like our whole bodies, a very delicate, correct balance of microbiota, bacteria and stuff down there. So we shouldn't be using anything that has antibacterials and whatever. Superwash, Coo and Clean, Clark Wash is totally fine. For babies, bathing babies, again, Coo and Clean is really made for babies. Clark Wash as well. And for baby sort of diaper areas, I love recommending virgin coconut oil, oils well. This is our little beat up bottle of No What Oil. For my kids, it was awesome because it really helps clean the diaper area and can help prevent diaper rash. So it's pretty awesome. And then obviously for washing baby faces, you don't even need soap. When they're very, very young, water is fine. Making sure to mention some of the stuff we have going on VMVHypoallergenics.com and .ph in the Philippines.com internationally. In the Philippines, we're offering mini-sized versions of our Stay Safe kit to help with the pandemic and such. And it's got nice antimicrobial essentials in travel sizes, so you can take them when you're doing your errands and whatnot. And in the USA, we're offering a self-care kit that you can customize with travel-sized products. In both cases, you get like a nice little pouch as a gift with purchase. And it's National Lipstick Month, so we're still doing the 40% off all month on lipsticks and glosses if you get 2. And so you know, all our lipsticks have coconut oil and monolaurin as well. Going back to things not to be shy about, sweating. I was mentioning earlier in the pre-live that I have hyperhidrosis, and so does my daughter. Mine got so bad I actually had Botox in the armpits at one point. It was awful as a kid. I kept destroying all my shirts and whatnot. But our antiperspirants is what I use every day. The Essence and also the Illuminance one. And they can be used on the palms of the hand and the soles of the feet. If they are really, really bad, Botox injections can help for months, actually, stop the sweating. And bromhidrosis is if that excessive sweating also comes with body odor. And while it might sound counterintuitive, using fragranced laundry detergents and fragranced anything, soaps and whatnot, can actually worsen it because the bacteria interacts and the smell just gets worse. So what we've actually done, and my daughter and I have done this, is after the antiperspirant, we'll put monolaurin gel, and this can be reapplied throughout the day as you need it. And then in terms of taking care of our more private areas, in case you have owies, sometimes we'll have itching or rashes. Virgin coconut oil is great, and boo-boo balm can be used on the genitalia. Petrolatum is a wonderful option for the genitalia. And by genitalia, I mean, so the vaginal area, scrotal area, but also the anal area if there are rips or tears or abrasions. So on that note, I will, an important note there. If, of course, we're talking about discharge or pain, I mean, really see a doctor just to make sure. For women, see your gynecologist to rule out a yeast infection. Very easy to treat yeast infection, so avoid tight underwear, jeggings all the time, yoga pants all the time. Wipe properly, right? Front to back, or just, pat. And again, avoid these douches and feminine washes, because that can really also mess up that. And if you're on antibiotics, remember to eat a lot of probiotics, kimchi and yogurt and stuff like that. And on that note, we'll get into the more medical aspect of it. I will bring on my mom, who is our founding dermatopathologist. Mom? Hi. Hi, come on.
Coming.
So, you look so lovely. Look
Thank
at
you. I thought I'd look summery because it's summer in New York.
Me naman, I'm so bagong ligo. I'm freshly showered, and she's all like elegant and nice. But Dr. Vermen Veralia Rowell is a dermatopathologist, researcher, teacher, clinician, etc., etc. She does do teleconsultations. And also a cappuccino lover, we just heard. She's also a licensed pilot, for those who don't know, and she's a pretty amazing dancer.
I forgot.
Wait. Yeah, your Lola is pretty awesome. I'm sorry. I'm going to make sure I
Thank
don't
you,
drop
Gab.
this. Okay.
And this is the cappuccino prepared by my 10-year-old grandson.
Yes. So
Yeah, I can't get the heart rate.
why don't you take a sip, so at least we're okay. She's done a lot of work since forever on patch testing and photo patch testing, which, as you'll hear, is really important for underwear, dermatitis, and all these other things that we're going to be talking about. And because she's a dermatopathologist, these are the people who read the biopsies that a dermatologist might take. She arguably has more exposure to infectious diseases than maybe the average bear.
And the depth of the skin.
So, say hi, Doctora.
Hi. Hello.
This is my
Hi.
grandmother.
Okay, I can move this way. You can move in so Madison can come in.
There you go.
So
in
yeah,
that
so
moment.
today again, as a
Go on.
reminder,
Come on.
Instagram, hey Instagram, allow landscape. I just want to
Please.
ask that for live.
Please.
So today we're going to be talking about skin, underwear, problems in the genitalia, the private areas, even sexually transmitted diseases, skin lesions related to them, and things that are embarrassing but shouldn't be. So sanitary napkins, hygiene, sweating, smelling, and stuff. For those who have specific questions, if you are still embarrassed to ask, you can send us a private message or a direct message, and we'll get your question answered anonymously. So let's start, Doctora. We'll ease into this by talking about irritations for babies and adults who wear diapers. So what are some of the causes with let's say, skin problems related to diapers, and how can they be avoided or soothed? That's my question to you, by the way.
Oh, question. Yes, I'm listening.
Okay, so I'll repeat that. I said let's ease into this by talking about diaper skin problems for
Right.
babies and adults. So what are some of the skin problems that we tend to see, and how can we avoid them or treat them?
Funny, I just saw a baby actually, who was 3 months old, with that kind of a problem. And the thing is that the problem with diapers is that they are indeed processed products that you put on the skin of a baby. And while this may not apply for the majority of children, there are kids that are already irritated by the chemicals that are used in the processing, like a little bit of preservative and maybe a little bit of an antibiotic that may have been added into the processing of it, including the making of the paper into the material into white, which is a bleaching process as well. So the important thing is to recognize and to look at the skin. The minute you notice that when you put it on, it becomes a little bit irritable, consider looking for another diaper. I've actually asked some parents to use cloth diaper, because when you wash with a cloth diaper, and I've even asked also parents to say, don't use the tap water, because many times the tap water coming from our government has chlorine added to it. Somehow they do. Then instead you can use bottled water, like distilled bottled water, and do that as the final rinse of these things.
There you go.
So the most important message is be aware. I mean, don't talk with your husband or somebody else while you're putting on the diaper, but actually look at the skin and watch for the earliest signs. Because the earlier you take care of any kind of a problem, skin in particular, the faster it is for you to recognize what may be causing it and therefore avoiding it.
And I always say, the less allergens and irritants the skin has to deal with in general, the better. So I did try to go the cloth diaper route, and I failed miserably. So,
Did you really?
yeah, there are some brands, especially in the United States, that do fragrance-free, chlorine-free diaper options. It just takes some looking, but you can find them. And I've mentioned earlier, if you cleanse the area with virgin coconut oil, it's great for removing soiled stuff, but also moisturizes the skin and can serve as a bit of a barrier to prevent diaper rash. So there, we have a couple of questions early. Go ahead, Lily.
May I just add?
Yeah.
I use coconut oil to cleanse as well as to treat. Cleansing, the first time I tell people, use coconut oil to cleanse that area, especially if they're very dry
So
and
vaginal,
irritated.
or say scrotal and anal area.
Right. And then they say, yeah, but oil? I said, well, if you think about it, history tells us that Cleopatra bathed in olive oil.
The earliest cleansers were oils.
That's right.
Yeah.
And the things that they add on to the oil to make it a bar of soap or to a cream or whatever, those are the additives that then irritate the skin.
Right.
Just think about that.
So, okay, very quickly, I want to get some of the questions in earlier for the people who came in early. We have one question on the topic of sex. Can a couple use VCO as a sexual lubricant? And the answer is yes, but not with a condom. The
Right.
fatty acids deteriorate condom materials.
Right.
And on that note,
Absolutely.
actually, yeah,
Yes.
so there are other lubes out there, but you probably need to look for stuff without allergens. And again, the best thing you can do is get a patch test with your dermatologist.
Yeah.
So you know exactly what it is you're trying to avoid.
I actually had a patient yesterday who said, had some, is already at that age that the area there is dry. And she said, it hurts, so what can I do? So the simplest I know of is to insert coconut oil. So we were laughing as she said, what can I do to put it in, with a maybe, I said, years ago I used to tell patients, get a pair of gloves. The smaller the better. Fill it up with coconut oil, tie up the fingers here, and put it in the freezer so it becomes like a white butter, and you can cut it up to size and insert it. And then finally I said, I'll tell you what, I'll tell this to the audience I was going to listen tomorrow. Get a 1 cc syringe, take off the needle.
Take off the needle! This is important.
Then absorb the coconut oil, whether you use it cold. I love cold because it minimizes inflammation of any kind that may be around there. So I use the cold one, and then I absorb it and I put it in the fridge so it's cold. And then push it in. The temperature goes below, higher than 25 degrees, that coconut oil is going to melt inside.
Very quickly. We're talking about insertion into the vaginal area or into the anus, or both?
Right. Or into hemorrhoids, for instance, is fantastic, because into
Wait, sorry.
Sure.
Is it like up your vagina?
Yep. Yeah, like a tampon.
Yeah.
Oh, okay.
And then do it
Just
at night.
sometimes people get irritations there.
Right, because until you become adept at this, do it at night. Lie down.
Yeah.
And then put a towel.
It's like a, what do you call it? A yeast infection suppository.
Also.
You put it up there and then you lie down, and
Yeah.
then, you put something because you're probably going to leak in the night.
Right.
It's the exact same thing, but with virgin coconut
You really
oil.
don't. Believe it or not, as you go about it.
Because it gets absorbed, I'm guessing.
It's like an oil that you apply, maybe an oil blot there, but when you put it on, it then blends into and it stays
Very nicely.
because it's an oil and not a mineral oil or a petrolatum or anything like that, which is on the surface of the skin.
There you go. Another question, thoughts on controlling breakouts due to, during and after birth control pills?
Okay, birth control pills are often, if they are estrogen high, they are actually used to take care of breakouts.
Actually, mine, I'm on Diane 35. I've been on it forever, and part of it was because of acne.
Okay. Yes. If you're getting pimples while you're on the pills, very likely the pimple may be triggered by something else. So therefore, consider things like the diet, lack of sleep, comedogenic products that may be using. Are we going to the face now or down there?
Still down.
Acne. Well, I suppose acne wherever. Acne where people get acne, they tend to get acne from certain birth control pills. You're right, sometimes.
Yeah.
But there are other so if you're experiencing acne because of your birth control pills, obviously don't stop them quickly. Talk to your gynecologist. Many times gynecologists and dermatologists will cross consult. She's had patients where she suspected something and needed sort of cross consultation with an endocrinologist or a gynecologist.
Right.
Your gynecologist might talk to a dermatologist, or you can ask them to, just to see, hey, my patient really needs to be on birth control pills or wants to, and is experiencing acne or hyperpigmentation, which can also be an issue. And the dermatologist will be able to say, okay, let's look at their history and maybe they can try this instead. And your gynecologist will help you transition properly, right?
Agreed. I totally agree in cross-consulting among us colleagues.
Yep, exactly.
I consult an infectious disease doctor and endocrine. This morning, a young doctor told me, I'm really quite trained because I was looking for a good plastic surgeon for the eyes area. And I said, call this number and talk with me. So she did. She said, okay, I'm going to have you talk at our next meeting.
Your doctors should talk to each other. They really should. By the way, just so you know, teacher Nika, Ugo, is here watching.
Hello,
and,
Nika.
She pointed out, it's true, we don't really have scientific names for genitals in Tagalog. If anyone knows what they are, please let us know. I'd really like to know. We have another question. What products to use to lighten the groin area?
That's a very good question. First, find out what causes it.
Exactly.
Once you know the cause, it's easier to bleach. The bleach will work. Many bleaches out there really work. In a month, it comes back, right? The reason, you didn't look for the cause. So the causes of pigmentation in that area are Anywhere from the irritant reaction to an allergic reaction to an ingredient of a product that you're using there. It may include, when I say product, it may include a simple thing as your sanitary napkin, the toilet paper that you're using, anything else that you may be applying there. So it could be product related. It could be related to the panty you're using and the laundry soap you're using for it.
For men who use like tidy whities instead of boxer shorts.
Yes.
Or even in boxer shorts, the elastic around the
And then for people with brown skin, and I mean not just brown skin like me, see the color shades of these three people? Color shade underlying is red, although she has white skin, right? This one here is also, hers is actually a different, I don't know, yours is red. Anyway, we're all brown skin, and yet we come from different kind of
different
backgrounds.
shade, different depths of tones of brown skin.
Correct. So there is a condition we call pigmented contact dermatitis. It is very often misdiagnosed or not even diagnosed at all, because I notice that people, this is men as well as women, consider the slow gradual darkening of that area of the body, and it extends into the uppermost mid-thighs, into the inguinal area, and if you look into the bottom of their buttocks, you will actually see the darkening there. Mm-hmm. This is called pigmented contact dermatitis. It is most often published in papers for the Asian, Middle East, and a few papers only coming from Europe, although it was first diagnosed there. Mm-hmm. Japan actually has a lot of papers on pigmented contact dermatitis. It is an unusual contact dermatitis because usually contact derm manifests itself as several stages of eczema. The bubbling, the subacute cane, and then the chronic, which is just dry and thick. This one never does. It just appears slowly, very gradually, like your melasma. It becomes darker over time without any irritation at all. And then all of a sudden, if you really look down, do that tonight when you go, or, and look for any discoloration there that seems to be progressing slowly over the years. That's pigmented contact dermatitis. The causes are the same allergens as the ones that cause frank contact dermatitis. Why it does that in these private areas? There are lots of theories about it, but you don't have to know those theories, just that discover them. Then have a patch test. Go to your dermatologist who does patch testing, who does it well, and have a diagnosis, have a list of the things that you're irritated or allergic to.
Okay, so what we've learned here is many times the darkening of that area, the groin, under the butt, the scrotum, etc.
The interanal area.
All those areas might be due to underwear, so irritations and allergy, but might be due to the underwear, and it can be because of the materials of the underwear. It can be because of the elastics and whatnot. So a patch test is really kind of important, because it doesn't start with necessarily with major itching and eruptions and whatever. It's often misdiagnosed, right? Because it is a hyperpigmentation, a darkening of the skin that happens over time and gradually. And so sometimes it's just dismissed as part of aging. But it is actually a reaction, right? It's a sensitivity that results in it's like a post-inflammatory hyperpigmentation, is what I'm understanding.
Right.
So first things first, for the person who was asking about lightening
May I just add to that subject?
Okay.
By the way, this pigmented contact dermatitis is very common also in the axillary area, not within the vault,
underarms,
but in the edges of it, because that's where the clothes touch, right?
Sleeves and
it's
bra,
also common under the breast.
Yep.
In the waistline, and if you have if your abdomen, is a little bit on the full side, it's inside, so you have to also look there and see if you have pigmented contact.
So again, I guess the first thing to do is first know it's not just quote unquote aging. Second, do see a dermatologist and perhaps ask for a patch test, right? And third, we really want to focus on prevention here, is probably your best bet. But just to make sure we try to answer that question, how can we treat it?
Okay. The treatment, there are so many treatments nowadays, ranging from topicals to oral. to lasers and various other gadgets that are used. They really work. But like I said, as long as you don't look for the cause, that's going to repeat itself in another month, 2 or 3 months. Melasma is one of those things, for instance, very similar. You can pigmentation. You can use topical would be things like the traditional hydroquinone, which a lot of people around the world still use. Problem with it is in certain countries they use very high concentrations, as much as 10%. The normal allowed in most regulatory bodies in the world is 2%. Beyond that is considered a drug. So there are 4%, which is the common one. There's another kind of a compounding which is called a triple combination of a steroid started by Al Kligman way back and is still a gold standard. Hydroquinone with retinoic acid and with a steroid. This you can use for a short period of time because of the presence of the steroid, but, and it works. Like again, it will recur if you don't know what the cause is.
Right. So again, there are treatments. Make sure, because these are quite strong, potentially irritating things themselves, the treatments, make sure they're done with a dermatologist first and foremost. Don't try it alone. Plus they're drugs, so you really should be having them with a doctor anyway.
Then there are also new chemicals that are being used by doctors, oral as well as topical, and majority of them really work on an antioxidant basis. They're very potent antioxidants. But lastly, however, there's something in the horizon. There are now new studies targeting in the molecules and the genes what are the parts of the genes that can be targeted, so that eventually all we have to do is drink something and we'll be fine.
So the point I wanted to get to though is make sure you don't self-medicate. Talk to your dermatologist. There are treatments that work, but this will recur if you don't do proper prevention. So you might want to consider, I had mentioned earlier, an underwear brand. I'll put it maybe in the comments later or when we post the replay. Look for unbleached, organic, unchlorinated, undyed cotton, latex-free, elastic-free, and get a patch test so you know what to avoid. We have so many questions, so I'm going to jump to that. Any recommendations for skin irritation around a colostomy? Either how to minimize or prevent?
Okay, two products, coconut oil and Vaseline. Pure petrolatum. Don't go and buy those petroleum jelly kind of things. I know, I'm sorry if I say this, but petroleum jelly, if you look at the ingredients, this is one thing I'd like you to remember. Always look at the labels in the back of a bottle, not just to the front, which is made to excite you and make you buy it. Look into the labels and look for the ingredients. Look for pure petrolatum, which is really just petrolatum and nothing else. No fragrance, no preservative, no nothing. Because petrolatum doesn't have to be preserved. There's no water. There's nothing to make it microbially incompetent. So, coconut oil is different from petrolatum. Coconut oil is made of fatty acids. And when you apply coconut oil into the skin, it breaks down into its component fatty acids. It's broken down by the normal bacteria that you have in the skin. And if you have other bacteria, they also have lipases, the enzymes that break down those fatty acids, the triglycerides rather, into component fatty acids of the coconut oil. So when you put it on, it is an occlusive because it is an oil. It is a humectant because because of that, allows the water to be kept in, so the barrier is repaired. Plus, the fatty acids now contribute towards the healing of that lipid bilayer of the cells, membranes that need to be repaired in either an irritation or an allergy in that area. So what you do is you put coconut oil, and to really slap that coconut oil down into the skin and keep it there, put on the petrolatum on top. And that, I tell you, another thing that makes it really wonderful, you bring that coconut oil into the refrigerator while you're, not doing anything. And then when you put it on, it is cool and it feels so lovely.
She really likes that because
and
it's
anti-inflammatory.
Cool. That's anti-inflammatory.
Right.
Quick thing. Hola, Fatima, the dermatology in Costa Rica. Our partners
hello,
in Costa Rica.
Hello.
I hope you guys are well. Okay, we have another question for you guys just joining us. 2 things. Please ask your questions early. If you are embarrassed, you shouldn't be, but if you are, we respect that. So send us a direct message on Instagram or a private message on Facebook, and we'll get to the questions and keep it anonymous. And for those who are joining, if you happen to be watching with your kids, none of this is risque or flippant. We're tackling everything very straightforward manner. And scientifically, but we are using proper names for everything. So we're calling genitalia, but the proper names, etc. Just for you to know, to make your own decisions. We have another question for bedridden patients. What can we recommend for a daily wash at the perineal area? And can we advise them to put virgin coconut oil as a moisturizer for every diaper change to prevent the occurrence of a rash? If there's already redness, but the skin is still intact, can we recommend VCO as a moisturizer? Yeah, so same.
Same answer.
So yeah, same answer. VCO is great. And I mentioned this also for kids and for adults with diapers.
VCO and petrolatum for the area of the problem, the irritation. Again, early. Watch out for bedridden people. The minute they begin to have that irritation there, you may be using something like a wash, a soap, a cleanser there. Just remove those. Just use the coconut oil and use it also because their skin tends to be dry all over as well. You're keeping them in an air-conditioned room probably all day and all night, and so their skin loses the fluid, more of the fluid that is there, and then the barrier becomes, compromised. So apply coconut oil all over the body. Put on the petrolatum on top of it, and on beginning the cubitus irritation, what will rapidly become ulceration because of the difficulty in turning them right and left.
Ulceration is the sores, folks.
Right. Okay. Now, when you already have an ulcer, am I going beyond the question?
No. So first question, let's make sure, right? So for bedridden patients, to cleanse the area, would you suggest just VCO?
Just VCO.
There you go. And then to moisturize as well.
Yes.
Right? And then a follow-up question to prevent bed sores for bedridden patients, same banana.
Same banana.
When
you already have
coconut.
Yeah, when you already have a little bit of a dent and ulceration is beginning, now you're serious about your work. You're going to apply again the coconut oil. You're going to put the petrolatum, the petroleum, not the petroleum yet, the petrolatum itself. And then many times in my own clinic, I'll use the monolaurin monocaprin ointment derived from coconut oil because it's just more of an antiseptic. And then you want that ulcer to start going up, the granulation tissue at the base of an ulcer bed. You want that to slowly grow up so that it will join the surface and so that the epidermis at the edge of an ulceration or a dent that's starting will slowly climb into and cover that skin. That's how you heal it. And the way we do it sometimes is we put occlusive dressing. There are many occlusive dressings there. My favorite used to be just applying a plastic, but I just had a patient yesterday who I found out the plastic has acrylates. Yeah. She was allergic by patch testing to acrylates. She was sensitive to the acrylates of the plastic. So we removed it, and instead we do wrapping again with another kind of a cover.
So folks, just to double down on what she's saying, again, it's all about, so much of it is really prevention first, right? When she has patients who are in the hospital because of steroid withdrawal or because of some other reason, and they call her in because there are other irritations
badly infected because of the steroid use for years.
Right. So what she'll often do is request that we launder the sheets ourselves for that patient using a fragrance-free, everything, etc., option. And she will ask the hospital to not do the classic, not use the classic products for cleansing the areas. And she'll ask them to use the virgin coconut oil pure. And then to massage as well, because the massage anyway helps with prevent the bed sores, because you get movement and circulation there anyway. Okay, moving on to other questions we got before. Hyperhidrosis, excessive sweating.
Right. It's not a disease, but it's something that...
Frustrating. I hated it. It was my nightmare as a kid. Awful.
I don't perspire. I mean, very little.
She's very lucky. She did not pass that gene to me. Everything she doesn't perspire, I do.
Okay. Remember that other areas do perspire. Okay. The cause for it is because some organisms may be present in that area and they break down the sweat. The sweat itself doesn't smell, but the bacteria, the organisms that are around, can break it down into smelly stuff. Okay,
but that's bromhidrosis.
Right.
The excessive sweating alone
The hyperhidrosis alone.
is
For
just
that,
sweating.
yes.
And it can occur in the armpits, but also palms of the hands.
The palms,
soles
the
of
scalp.
the feet, the scalp.
So you get
behind
forehead
the butt,
acne.
right? The butt and
the
behind
back.
the legs.
So we have
Oh
what
my
we call
God.
sweat acne is usually refers to the back in people who exercise and
Right.
perspire
But this
like
is
mad.
from hyperhidrosis. It's excessive sweating.
Right.
And I mentioned earlier to some of the viewers that I actually had to have injections, or I chose to have injections in the armpits to stop sweating for, it was like 9 months at a time.
Works
Really
like
fantastic.
works and amazing. Again, go to your dermatologist to do that because
Exactly.
they do.
And you can get it on the palms and the soles. What about on the butt and behind the legs? Sorry,
Never done that, but it's possible.
You can use the antiperspirant there. We have a question.
Yes.
So bromhidrosis
The other
is when
thing-
it comes with smell.
The other thing I do in people who really perspire so much is apply the antiperspirant twice a day.
Yeah.
At night, just before you go to sleep, when you're already calm, collected, there's no perspiration, put it on that area that sweats. The following morning, put it on again, and you'd be surprised.
Okay, so bromhidrosis naman is when the smell is there, and that's because of the bacteria you were saying.
All you have to do is be more careful about bacteria being there and use coconut oil.
Or
What can I say?
monolaurin, right? So Nika's asking, armpits, anticipating our daughters as they get older and whatnot. How about kili-kili, underarm depilatory procedures for young women? And someone else actually asked about laser hair removal in the underarms and groin.
I think it's terrific. Have it done because, using the waxing technique, I've seen my children and, undergo all of those and then they keep recurring and, they hurt and then.
So laser's
So
not bad.
laser isn't bad at all. Because
Actually,
that's
my
permanent.
daughter, I wish she were still here. I don't know where she went, but she started laser hair removal last year. So age 12.
Yes.
And part of that was, I mean, I don't care about hair in the armpits for women. It's just something I choose not to berate my daughter on. I figure the world will influence her, and I like her knowing that it's a choice. She doesn't have to remove hair from her body. She doesn't want to. So it wasn't about that. Interestingly enough, it was because of the sweating. The theory that my mom and her colleague had was the laser hair removal might actually help with the excessive sweating too.
Right.
So that's actually why we did it. No, Mads, come here. I was talking about the laser hair removal and when you started it and why we started it, which was for the
This
sweating.
is my granddaughter.
Yeah.
Hi
So,
again.
right, you did the laser hair removal.
Yes. Technically, we're not done yet.
Yeah. We're not done yet.
Ow.
Because
Technically, we're not
COVID
done
hit.
yet.
But
Yeah.
but we did it, in part really because of the sweating actually,
for
right?
sure.
Because she has a bit more of my hyperhidrosis condition.
I didn't really care about it's a plus because I dance and
Yeah.
I wear leotards, but I can easily, just shave or wax.
Right.
It's
But again,
nothing.
she knows we don't care about hair in the
Yeah.
armpits or hair on the legs or hair in the groin or whatever.
I mean,
So-
I've never
But in
shaved my
terms
legs.
of skin health and whether or not to do it, there are some pluses for sure. One is it might help with excessive sweating. But as with all things laser, and she'll definitely say this all the time, go to a specialist, particularly if you have brown skin, who is used to dealing with brown skin, because hyperpigmentations can be a risk with lasers.
Right.
So
Yeah, very good. This is actually what she was talking. I was thinking I'm going to have to add that. Yes, Lau.
Thanks,
You
Mads.
must go to a specialist on lasers with a dermatologist. There are so many side effects of lasers,
Yeah.
including in particular pigmentation and burning and
Exactly.
go to I don't do devices as much. I have only one device, 2 or 3 that I use a lot of. But I send to my specialists, super specialist dermatologist friends to do things that
Laser,
I know
yeah.
I'm not adept at.
Yeah.
And I'm already a dermatologist. So go to somebody who's really an expert in it.
To
Okay?
add in the depilatory things, in the United States, in New York, we also do sugaring. Sugaring is nice because there's no heat.
Right.
Waxing can also cause hyperpigmentations because of the heat, right?
That's right.
It's inflammation.
That's
and it's
right.
ripping. Sugaring doesn't even hurt, not even remotely as much. Far less inflammation, far less heat. So check in your country, in your city, if someone offers sugaring, because it's a great idea. And
Right.
immediately after waxing or sugaring or laser, add ice, put an anti-inflammatory. It just works.
Right,
One
right.
more tip I want to share for those who are going to get injections there or going to do depilation or whatever. I swear by ice. I know people like the topical anesthetic, but for me, it's not enough. I ice for a long, long time to get it really numb, and then even then it's painful. Okay, best thing, causes of warts on the genital area, and prevention.
Causes of warts in the genital area. Again, you wonder why. Never go ahead and treat without asking the why. Okay, you can get it from your partner.
Mm-hmm.
You can get it from a roving hand. I've had to reassure a husband one time that his wife, who had traveled somewhere, came back with warts there. Said I had to reassure him that it's not just from sex. It's not just from close contact. That it can be actually from the toilet seat, so to say.
Touching stuff.
Yeah, touching stuff.
Even herpes.
And then scratching down
Even
there.
herpes. Herpes carries so much shame with it. But not all herpes is necessarily sexually transmitted.
That's right.
A fever can be herpetic, right?
Yeah.
A canker sore. I am the queen of canker sores because of my auto-inflammatory condition. My record is like 80 in the mouth. So maybe we'll do a whole live stream just me on canker sores and how to deal with that pain.
We should, yeah.
But yeah, herpes is not necessarily sexually transmitted.
Oh, no.
And to be clear, just because a skin condition or anything is sexually transmitted doesn't make it, quote, bad. That means maybe you need to use better protection, right? But also with condoms, a nice note that she gave was some condoms do use allergenic materials.
Mm-hmm.
So do get that patch test so you know what to avoid.
Right.
But the genital warts, let's go back to
I have a beautiful story. I had a young girl who was getting married, but to a conservative family, right? Both were. But she developed herpes simplex on the lower lip, right in the middle.
Mm.
The family was distraught. Both the husband's side in particular and the wife's side. So she comes crying to me and said, why do I have herpes simplex? You know, they say it's bad, it's sexual. Anyway, as she's doing this, she's becoming very distraught and she gets her crucifix and puts it on her lip. This is a real fantastic story. Puts it on her lip and she puts it down again and then does it 2 or 3 more times. And I said, I think we've solved your problem. You're allergic to nickel. Tell your husband from now on only 20%, only high quality gold.
But even gold is an allergen, so get a patch test so you know what you can use. Okay, we don't have a lot of time.
So
We
again,
have about 9
the
minutes.
message there is the cause has to be treated. So it has to be seen first.
Okay.
Okay?
Guys, we have, so genital warts can that be molluscum contagiosum?
They are also called
Okay.
warts.
Right, so it could be viral, it could be bacterial. Don't be embarrassed, see a dermatologist because you want to make sure you rule out, could it be, molluscum contagiosum can affect children, so they're not necessarily sexually transmitted. It really could be any number of things.
Yeah.
So do see a dermatologist to get them treated. They must be treated because it is an infectious disease.
The
But
reason
it's not anything to be ashamed of. You need to know what
the
caused
reason
it.
children get it more and they have them all over, is because they don't have the resistance yet to that particular virus. As we grow older, we've been exposed to it, so we don't get it until later in life when it can become sexual, for instance, especially in the lower area. But like we said earlier, it doesn't have to be from sex. It can be a roving hand.
Okay, do you have any recommendations for laser hair removal in New York City who's sensitive to issues of contact dermatitis? I will answer that separately. How about that? How about
Yes.
we add to the comments later? There are many contact dermatitis specialists in New York City, many of whom we work with closely. And maybe, actually, the better thing is to give you a list and see who does laser. But we'll take that offline. Thank you for that question, though. Eczema in the nipple area. Is this common?
Very common.
Oh, and what to do?
Yeah. Eczema in the nipple area can be, of course, with what's in touch with it. And because many people use bras with a foam, and it's the most air part of the body that juts out and is in contact. So it can be from rubber or from the elastic or the latex kind of material that is underlining your bra. If you don't use those and you're using just 100% cotton, it can be used to the laundry and the water. Okay. So what I normally teach people is to get a piece of old hanky and just wash it by hand wash and in distilled water, no soaping necessarily, or use a hypoallergenic soap.
Patch test, guys.
Right.
Patch test. See your
Very
dermatologist.
often.
Guys, we have 7 minutes left, and I need time to sort of talk about other stuff.
Hold
and
on,
answer
before
some
I go.
questions. Yeah.
If it's an eczema, if it's a patch that is persistent though in that area, go to see a dermatologist, because it may be a little, growth that is happening that should be looked at by somebody.
I want to make sure I get this in here. There are skin lesions, or there are sexually transmitted diseases and other infectious diseases that can manifest as skin lesions, right? So we talked about a few: warts, herpes, but also HIV can sometimes have stubborn lesions, gonorrhea, and syphilis. Yeah. So definitely, if you have something that looks untoward, especially in that area, itching, certain lesions, whatever, in vaginal area, penile area, scrotum, anus, etc., do see a dermatologist just to rule things out. Practice safe sex. I don't care. I mean, back in the 90s, it was all we could talk about. There were condoms everywhere. But do practice safe sex. And
before you go on that,
yeah.
This is COVID-19 times. More and more skin lesions are being described with COVID, and many times they can actually precede the symptoms that we're being told about, the tightness of the chest and all that. There are lots of rashes that they have described urticaria, rashes, similar to the things we discussed.
Right.
If they look curiously different from the usual that you have,
talk to your doctor.
Talk to your doctor.
Okay, one last thing before we go. Because, I'd mentioned earlier that so many women in certain parts of the world get marketed mucky sanitary napkins and stuff, okay? For women, again, back to this, my personal pet peeve, as I told you, I don't understand why everything has been being marketed to women like somehow we smell bad. We don't. We smell like we smell, as nature made us. So sanitary napkins with perfumes. I mean, the itching is just awful. I had one of the worst irritations I've ever had, and when it's down there, it's just ridiculous. So VCO, avoid all, fragrance, etc., etc. But do try to look for sanitary napkins without fragrance, first and foremost. And then for cleansing that area, what are they called? Feminine washes that are highly fragranced, or God forbid, antifungal, antibacterial.
Or have acids in them.
Just do not. They're unnecessary and potentially really damaging. They can cause skin irritations, but they can also really offset the natural balance of microbiota that we have in that area. So please do not. No gynecologist or dermatologist will ever recommend those for cleansing the area. So there, I think we can ask one last thing. Okay, so I think we're good. I'm going to let her go because I know she's super busy.
Yeah,
I'll stay on she has a patient. I'll stay on for 4 minutes just to close out. I've seen some comments that this is it's a little short. So if you guys want us to do a part 2 of this, write it in the comments. Let us know in the comments anything else that you'd like us to talk about. Okay? Otherwise, thank you so much.
You're most
Love
welcome.
you. Have a great day.
Bye-bye, everybody.
Good luck with
Have
your
a good day. Be careful. Practice social distancing.
There you go. Yeah.
And wear a mask.
Okay. So very quickly, we promise, my team there, I'm asking for help to get back to you who asked about laser contact dermatitis sensitive doctors in New York who can do laser. For laundry detergent, there was a question here. We do make a product called Fawn and Launder. If it's in stock, that's what we definitely recommend because it's made specifically for clothing contact dermatitis and for babies, for very sensitive skin. If it's not in stock, again, I really apologize, but even our suppliers are struggling with the pandemic. People use superwash, just dilute it, right? And use it for baby sheets and clothes and for your underwear. And then I wanted to mention, if you do have abrasions and, what material of menstrual cup is safer? Oof. Okay. Silicones are not bad. From our research, silicones are not allergens. Just look for something that is undyed, does not have color. Make sure, get a patch test, because if you tested positive to acrylates, this might be an issue because some plastics do contain acrylates. She mentioned this earlier. So get a patch test with your doctor. I want to make sure to close out. Guys, please continue asking us questions. If we can't answer them now, we'll answer them in the comments, in the replay. These comments will disappear, by the way. So if you do have a question after this, wait for the replay, ask them there, or send us a DM or private message on Facebook. On VMVHypoallergenics.com internationally and in the Philippines at .ph, we do have several specials on lipsticks, on gentle caring products that we mentioned today for these areas, these sensitive areas. If you would like a teleconsultation with my mom or any other dermatologist we work with, send us a DM or private message and we'll help make that happen. As a reminder, if you've had a patch test, you can send us your patch test results and we will customize recommendations for you based on your allergens and your cross-reactants. And we'll be doing these live streams every Friday, so please do let us know what topics you want us to cover, or if you want a part 2 of this, if you didn't get to ask your question. They're always Friday, 9 a.m. in Manila, which is Thursday night, 9 p.m. Eastern Standard Time. Replays will be coming on IGTV, and they'll be up on Facebook anyway. And that's it. Subscribe to our emails to know news and stock situations. And follow us on YouTube, Instagram, Twitter, and Facebook. And I'm on @Laura@VMV on Instagram if anyone wants to chat anything. So, guys, stay safe. Love your bodies. Don't be embarrassed about anything. All of this is as nature intended. We're very happy to answer anything privately and professionally and with empathy. So take care. Be safe. Look out for each other. Don't forget your mental health. And we'll see you next week. Bye, everybody.